And I'm going to pass it off to our guest facilitator today, Stephanie Stolzenbach. I hope I said that right. I hope I said that right again.
Yes, you
And
got
she's
it.
the
You go
direct.
for it.
She is the director of clinical services at the leadership program. She is also does some teaching at Columbia University. She's a very, 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 very proud mom and really looks at this entire scope of learning just through that lens. And she's an avid Netflix binger, which I thought we all wanted to know because, it's very, very critical to find that me time. So on that note, I'm going to pass it over to Stephanie. And Stephanie, let me know where to go.
Over to Stephanie.
Awesome. Thank you so much, Jorge, and good morning to all of you. Happy Wednesday. I hope that everyone is doing well as the snowstorm is coming our way, I think for a lot of us here in New York. But I hope everyone is doing well. And thanks again for making some time in your busy week to join us this morning. I'm so excited to have Jorge as my sidekick. He is fantastic. And so thank you, Jorge, for your support as well in this workshop. Again, our focus for today is really just having a conversation around effective trauma responses for working with schools and communities, right? All of you have, I'm sure, so much knowledge already in the area of trauma-informed care. So my hope today is that we're going to do a little bit of a review around some of those major concepts and kind of key takeaways, and then shift us into kind of expanding even beyond trauma-informed care to another framework, which is called healing-centered engagement, that really stems from the amazing work of Sean Gin Wright. He's the author of this book. I just wanted to plug Hope and Healing in Urban Education, How Urban Activists and Teachers Are Reclaiming Matters of the Heart. So I've been super inspired by Sean Gin Wright in his book. And I'm sure folks on the call have also heard of him and his work, but I wanted to kind of deepen and expand how we are approaching our work with young people, and how we all have the capacity to really be healers for those that we serve, as well as, of course, for ourselves and our colleagues. So we're going to go ahead and jump in. So I have for us this morning an essential question and also kind of an objective for our time together, which I know is shorter than any of us would like, just because this topic is so robust. But I think we're going to just kind of have a really great session despite our time constraints this morning. So I want to focus on our essential question, which is how can we as stakeholders expand our work from a model which often views trauma as kind of an isolated experience to an engagement model which really supports collective well-being. And our objective for today is, again, really kind of understanding trauma-informed principles, increasing our awareness around the different types of trauma responses in young people, and lastly, really expanding the work that we do to kind of, again, deepen and expand from trauma-informed care models to this kind of newer healing-centered engagement model that has a really strong social justice lens. So a few quotes for us to kind of ground our conversation this morning. We have one from the really well-known Peter Levine in his work as a trauma researcher. And he shares this with us, that trauma is perhaps the most avoided, ignored, belittled, denied, misunderstood, and untreated cause of human suffering. And our next quote on the right from Stephen Porges shares this with us, that trauma compromises our ability to engage with others by replacing patterns of connection with patterns of protection. And for me, this quote really resonates, I think, in the work that I do, overseeing mental health programming in schools and thinking about anti-oppressive mental health programming. When we see young people and noticing their behavior, right? Are they connecting or maybe kind of coming into after school spaces or counseling sessions with a little bit more of a protection going on, and kind of understanding what that might be kind of saying to us, right? Because all behavior is communication. So we're just going to kind of have these quotes in our hearts and minds as we move forward this morning. So and just an important reminder during this difficult time that we're in with ongoing COVID, the holidays, we're kind of in this season, which can be challenging for many of us. And now we're talking about trauma. So just really wanting to remind you all to really take good care of yourself this morning. We all have different experiences, backgrounds, and identities that we bring into this conversation. So please just make sure you kind of do what you need to do, taking some breaks, having your coffee, maybe a second cup of coffee or tea, and just making sure that you're taking good care of yourself. So again, our roadmap for today, we're going to do a little bit of reviewing, thinking about what are ACEs, and that stands for Adverse Childhood Experiences and their impact on social and emotional learning and behaviors in the work that we do. Certainly identifying opportunities and thinking about how can positive experiences in the school setting really support young people who've experienced adversity. And then lastly, again, expanding new practices, new approaches and frameworks, again, with this notion of trauma-informed as well as healing-centered practices. So I'm really excited to kind of get to the middle and end of the presentation and kind of hopefully introduce some discussion around these concepts. So we wanted just to kind of start again and checking in with where we're at this morning. We all have so many different experiences with trauma-informed practice from different workshops that we've been in and in different work that we do in our day-to-day roles. So Jorge set up this awesome mentee, again, with this website here. We're encouraging folks to go to this website and just share with us what comes up for you when you hear trauma-informed practice, a word, a phrase, and we just want to kind of build upon some of the knowledge and expertise that we have in our virtual space this morning.
Folks, if you're unfamiliar with Menti, just go to menti.com and plug in code 6644331. Again, that code is 6644331.
Thank you, Jorge. So we're seeing already some sharings here, right? Whole person, pain and hurt, empathy, caring, awareness, kindness, support. I'm loving this. Yes, awareness and understanding. Meeting kids where they're at, absolutely. Understanding someone's experiences that are often non-recognizable or easy to identify or observe. I love that. Whole child health, right? That holistic view of an individual. Absolutely. We're seeing here also hope, resilience, yes, awareness and acknowledgement. Listening, I love that. Thank you so much, everyone. These are really, really powerful phrases this morning. Give folks maybe just another few seconds here. Yeah, knowledge of person's experiences, absolutely. Again, awareness and responding to different challenges with youth. That's right. Kind of that caring approach that we bring into the roles that we have. And I love this word inclusive, whole person support in responses to traumatic experiences. And I love this, yes, understanding the brain impact, right? In the hope of neuroplasticity. Absolutely, how we actually have the power to change the structure of the brain through positive experiences with young people that we can cultivate, that we kind of have that great responsibility to implement in the work that we do. Patience, and I love the word healing. Thank you. Wonderful, wonderful responses, everyone. Thank you so much. It's a really nice segue into this video that we're hoping to show, just about 2 minutes and change, around the power of positive experiences for children. So we're going to go ahead and take a look at that together right now.
Folks could just give me a thumbs up on the audio, that would be great. And also, as typically, there is a delay with Zoom, so it might be a little bit choppy, but you should hear the sound fine.
When we use the word trauma, many people feel that we're talking about just a small percentage of kids. But the fact is, trauma is much more ubiquitous than any of us know, and certainly we have been in many schools in high poverty communities where the children exposed to trauma is greater than 50%. I began by working as a child psychiatrist with kids who had known trauma. They came to my office often complaining about the same things. Certainly trouble in school, distractibility, impulsivity, sometimes aggressivity, and a lot of trouble trusting and having good relationships with kids or with adults. Adversity doesn't just happen to children. It happens inside their brains and bodies through the biologic mechanism of stress. Children under stress will have release of the hormone cortisol, and cortisol has effects on the learning center of the brain, which is the limbic system. At the same time, if children have a buffering relationship and the release of the hormone oxytocin, this will oppose many of the negative effects of cortisol and result in some of the resilience that we see and a normalization of brain architecture. If we're going to design schools that develop a learner who can learn anything, then that school needs to be designed for children who will come to school at different starting points. Stress and trauma cause uneven development of certain kinds of critical skills and mindsets that kids need for learning. So if we design those into a school environment so that things like self-regulation and executive function and growth mindset are things that we can actually build, then in effect, we've created schools that'll have the physical and emotional safety, the sense of belonging, the relationships, and the intentional development of the skills and mindsets associated with learning. The story in developmental science is an optimistic one, and it rests on the fundamental property of the brain that is its malleability. Negative things in children's lives can certainly do harm, but positive things can restore children to a healthy developmental path. More importantly, if we provide integrated developmental experiences for children in schools, we will not only enable them to recover from the effects of trauma, we will unleash the potential that exists in every single child.
Wonderful. So again, that was some powerful words from Dr. Cantor, and the source there is Turnaround for Children. So we wanted to share that this morning and just kind of bring that word hopeful that we saw earlier that was resonating and kind of living in a lot of you this morning. We're going to kind of harness that hopefulness through the research of brain science, right? And really thinking about the power of relationships as a really powerful way to mitigate, right, the impact of adverse experiences. So thanks, Jorge, for showing that video for us. And we can go ahead and move forward into our next slide. And what we're thinking about now is, based on this video and based on your own work, right, the great things that are already happening within your organizations and your work environments, just wanted to see, like, what is that optimistic story, right, that as we're hearing developmental science is telling us about children who have experienced adversity or trauma. What comes up for you when you think about the optimism that does exist, the hope that really does present in the work that we do each and every day? So again, we have one more mentee because we're loving the mentee. It's an amazing way to kind of capture where folks are at, what's coming up for you. So if you would, we just encourage just some sharings or some contributions from you all around this question.
So folks, you could scan that QR code and just drop that link in there, and we're going to bring that up in about a second. All right, let's see what we got.
Awesome. Thank you. Oh, this is great. So we are all able to change and grow, right? We're not fixed beings. I love that. Effects can be minimized. Absolutely. Again, this concept of resilience, that bad experiences that cause trauma can be transformed into positive experiences. Yes, 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 through support and appropriate resources. I'm seeing positive relationships can make all the difference. That is so true, right? I'm sure for many of us, we can think back to our own adults in our lives who really had a positive impact on us as young people as well, right? Thinking how enrichment really provides intervention to build neural pathways. Yes, hope for improved futures. We can all unlock all kids' potential. Yes. And certainly amazing resilience and growth in children who have the support they need. Absolutely. Resilience, right? Being able to kind of bounce back, and that these children need wraparound services. Some never recover. Yeah, I think that's an important contribution there, that having a vast array and spectrum of services and really meeting the individual needs of every child is a really important part of this conversation as well. Relationships are one intervention, and sometimes there's many other things that we can activate for young people to really not just survive what they've experienced, but really thrive, right, as young people moving forward in their lives. And I love this, traumas don't define students. We have the ability to still help them grow. Absolutely. Thank you so much, everyone. And next we just have an overview, again, of key terms. I realize that a lot of us are familiar already with these. Just a kind of a quick overview of ACEs. We have adverse childhood experiences. And what we know is that there's been a lot of research done that connects what could be potentially traumatic events that young people have experienced or witnessed, and seeing their connection and correlation to health outcomes as adults. We're also looking at toxic stress, which is defined as repeated and chronic exposure to ACEs over time, right? And often without the support of other protective factors. And again, what we know, without that buffer, the body's stress response is kind of in overdrive most of the time. And then lastly, we have a definition for trauma, which is an experience of an actual or perceived or threatened negative event, or perhaps a series of events that causes emotional pain, right? And a sense of feeling overwhelmed. So we hope this is kind of a brief recap for a lot of us on the call today. And what's really important to note is that individuals respond really differently, right, to different events. So this notion of trauma is really about the individual's perception or psychological reaction and physiological reaction, to the event, that really determines whether or not it's an experience of maybe toxic stress or something that is labeled as a trauma. So we can't like overgeneralize or make assumptions about any experience for anyone that we're working with. And just quickly, a couple, again, reminders here on different types of adversities. We have a few slides. Certainly abuse and neglect fall into these categories, and we're thinking about physical, emotional, and sexual abuse, as well as certainly physical and emotional neglect. And we're also thinking about adversities within household stressors. So some examples here, we have our severe poverty, mental illness, caregiver that's treated violently, incarcerated relatives, military family related stressors such as deployment, parental loss or injury. And then next we have abrupt, unexpected, or violent deaths of loved ones, forced separation from caregivers, and certainly divorce and substance abuse would fall into this category. And next, we're kind of thinking about, right, moving out a little bit beyond the individual or familial stressors, thinking about societal and community experiences that can also impact children and adults. Things such as pervasive community violence, racial and xenophobic hate and bias, certainly bullying, terrorism and war, and then other threats, including things such as natural disasters, serious accidents, and also life-threatening illness. I know that can be a bit triggering to kind of just hear all of that at once. So if you just want to kind of take a collective breath, inhaling, and kind of just exhaling, letting that out a little bit, taking good care of you. As we move into this really important topic next, which is thinking further around systemic adversity. Thinking about the importance of acknowledgement around historical trauma, racial trauma, and systemic oppression. So we have a few definitions here that come to us from the National Equity Project, one of my kind of go-to organizations for resources and information. And so they share their definitions with us here of historical trauma, which is really referring to cumulative emotional and psychological wounding as a result of group traumatic experiences, and thinking about how this can be transmitted across generations within a community. Next, we're thinking about racial trauma, which is referring to events that occur as a result of witnessing or experiencing things such as racism, discrimination, or structural prejudice. And then lastly, we have systemic oppression, which is really referring in their words to the ways in which any given form of oppression, race, gender, class, language, sexual orientation, kind of all of the social identities that society kind of ascribes to us or kind of makes us check off in a box, how these things may be holding people or groups back from achieving progress on things that are really important to them. So we do have, next for just kind of a really powerful video that gives a little context and further information around historical trauma and systemic adversity. And so we wanted to go ahead and take a look at this. This comes from the University of Minnesota Extension, and this came out in 2015. So we're going to go ahead and play this video for all of you now.
What matters in life is not what happens to you, but what you remember and how you remember it.
My dad said when they were growing up, they said, we used to play cowboys and Indians. And he started telling me this story. And we used to fight over, nobody wanted to be the Indian. And he said, I didn't think about that. We'd all play, and I'd always suck it up, and I'd be the Indian. But how ironic is it for a bunch of Indian children to be playing cowboys and Indians, and nobody wants to be the Indian? The introduction of a destruction of culture and loss of what is good. And I asked my dad, well, why didn't anybody want to be the Indian? And I thought I knew the answer. He said, because everybody knows the Indian dies. And that already in his generation, as strong as he was, he received a message as a young child. I received the same message, that it was not good to be Indian.
Slavery, colonization, forced relocation, and other historically traumatic events in generations past have lingering and profound consequences today. But what is historical trauma?
Historical trauma has to do with collective, cumulative emotional wounding over and across generations that results from massive cataclysmic events. These are events that don't just target an individual, but they target a whole collective community. Things like forced relocation from traditional homelands, like the Trail of Tears, like my ancestors went through. But the process that our communities talk a lot about is that the trauma is held personally, and it can be transmitted over generations. So even family members who have not had a direct experience of the trauma itself can feel the effects of that event generations later.
Does historical trauma only affect certain groups of people?
what really helps me to help people understand the notion of historical trauma is that it's actually a phenomenon that lots of communities, indigenous communities, or people all over the world have sort of kind of struggled with. It's not something that specifically is only owned by tribal people or indigenous people. It gets articulated all over the world.
Historical trauma is widespread, affecting many communities across the globe.
Observation has, from the empirical side, started with work on the Holocaust survivors. And there's a lot of work on intergenerational transmission of trauma. And it's moved into also looking at Japanese internment survivors, Armenian survivors, descendants of their Holocaust, and so forth. So there's been some more empirical work in this area. And you can imagine trying to track trauma over generations and trying to tease out what is the impact over generations on this child, combined with whatever traumatic events they've gone through in their childhood and in their lifetime.
Historical trauma is passed on across generations.
I say to you, acknowledgement is due my grandfather, Pop. He never told us the stories of why he did certain things. He never shared with us why he never cried, for example. He never shared with us why he walked out the door when my grandmother cried. Why he turned his back when she cried. Of course we thought he turned his back because he didn't care, of course. But he turned his back, as I look back now, because the pain has no words. I still have the images of him dealing with the limitations that he was up against. I can only imagine the pain. But what I do know is that it didn't go away. It came inside into those of us who followed him.
No one ever talks about the moment you found out that you were white, or the moment you found out that you were black. That's a profound revelation. The minute you find that out, something happens. You have to renegotiate everything, and that's a profound psychological moment.
I saw a water fountain that said white in color. My family was 7 kids by then. We drank a lot of Kool-Aid. So colored water, that was in my cognitive schema. So I go toward this colored water fountain. And while I'm there, just before I get there, there's a little white girl who saw that same colored water fountain, and she was just about to turn the sprocket when her mother came and grabbed her by the arm. And she said, "You cannot drink from that colored water fountain." And she said, "But I want the colored water. I want the colored water. Oh, I want the colored water." So I knew it must be good. So I run to the colored water fountain, looking for my mom, making sure she won't stop me from drinking. And I turned the water fountain, and it was clear, just like at home. That day, that trauma, I remember to this moment.
For African American communities, historical identity and understanding is inextricably tied to the reality of enslavement.
It ties us to enslavement with what an awful terror, 400 years of trauma we experienced. And for us, we talk about it as being utter cultural erasure.
Thanks again, Jorge, for playing that for us. I know that's a really profound and deep and quite triggering video for many of us on the call. So our hope here is that we're just thinking about holistic care, right? And thinking about all of the individual, organizational, communal, historical, and socio-political realities and impact on the young people that we serve. And so in that spirit, we're just inviting folks to share, are there ways to kind of help mitigate perhaps the effects of historical trauma in the work that we're doing now with young people or with adults around us? Are there things that can disrupt, support, again, or mitigate the effects of historical trauma? So we wanted just to offer that as an invitation for a few moments together this morning before we move forward into a really powerful quote that kind of gives a little bit more hope and healing. Thank you, Unique. Be the change. I love that. Nafisa, having a conversation about it. Absolutely. Thank you for that. Teaching our students and team members. Jesus, acknowledging it, right? Speaking openly about it and validating generational experiences. Nuri, opportunities for storytelling and sharing. Susan, teaching true history. These are such amazing contributions. Zachary, don't shy away, right? Talk about it. Ryan, focus or highlight on their historical victories or accomplishments. Absolutely, kind of maybe not focusing on the single story of any one person or group of people, right? Collectively, but kind of widening the lens and the scope. Paulette, embracing what has happened with your own experience through healthy therapy. I love that, in ways that we can learn, grow, educate everyone around us. Gabriel is sharing, listening to hear instead of responding. Love that, right? Not just listening to kind of think about what am I going to say next, but really taking in that full person's experience. Joanna, addressing it whenever it rears its head into a moment. And Nafisa, be honest, right? Name it to tame it is what I always talk about, especially as a white identified social worker. I'm also a mom of multiracial children. So this work is both professional and personal, this content, but name it to tame it in the work that we do, right? It's really important to acknowledge it as we're kind of seeing from our community this morning. So thank you, thank you. If you know and understand history, you won't repeat it. Thank you, Devin. So true. And Joanna, see something, say something, right? Yes, yes, yes. So thank you, everyone. We're going to go ahead and just keep it moving for sake of time. We could probably be together for a full day on this particular topic. We wanted to share this really powerful quote from Kazu Haga. And it looks like, Jorge, maybe we lost that slide. Just a moment, folks. And Kazu Haga is actually a really incredible activist, and he does a lot of healing resistance work in restorative justice. He's one of my favorite kind of inspirational folks doing this work. A lot of his work has been out in the Oakland, California area in this kind of topic and theme of historical trauma. So he's really sharing with us a lot of powerful words. And he has a new book that just came out that I think is called Healing Resistance that I just saw on one of his websites. But he's asking us to think a little bit about if intergenerational trauma exists, and we know that it does, then right as well as that, we also have intergenerational resilience and wisdom. It is in our genes and in our DNA. So it's a little bit of, I think, a powerful takeaway in this conversation, again, of historical trauma, that yes, this is true. It's like a yes and, right? But we also all carry intergenerational wisdom. So we wanted to kind of just share that with you all and hope that that's something maybe that you could bring into, who knows, like a staff training or like the work that you're doing with young people as you're kind of naming and talking about generational trauma. And another fantastic book that I've read is My Grandmother's Hands. That has a specific focus on racial trauma and healing that I just wanted to offer to the group in case folks would like to read more about this topic. Great, and our I think this might be our last media clip for today's session, but we wanted to share the incredible Dr. Nadine Burke. She has an awesome TED Talk. We're going to show a clip from that, and has also a really awesome book about ACEs and childhood trauma. So she's going to talk to us now a little bit about the brain science and how ACEs do impact health outcomes. So we wanted to kind of center her voice as the expert in everything brain science. So we're going to go ahead and take a listen.
Turns out this is exactly where the science comes in. We now understand better than we ever have before how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging. Children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed.
Thanks, Jorge. We can
this information.
So powerful, right? These, the science behind oftentimes what we're seeing in our work with young people, because oftentimes trauma doesn't present as a memory, it presents as a reaction, right? As a behavior. And our role is really kind of uncovering, what's going on underneath that behavior? What might this be a sign or a symptom of, right? Just being really curious always in the work that we do, both with young people and also with our staff members, right? And the adults that we're working with. Yeah, thank you so much, Carolyn. Oh, that's so cool that you read her book as a staff. That's such a great idea, The Deepest Well. And again, this is just a short clip from her much longer TED Talk that might be worthwhile also for like a staff meeting or further discussion. So great, we're gonna go ahead and move forward. Again, just a kind of
through my old training
recaps before we move into our kind of additional framework. So again, just some reminders here from 2017 from the National Child Traumatic Stress Network in SAMHSA, that more than 2/3 of children in their research reported experiencing at least one traumatic event by age 16. And among school-age youth, there's some really profound numbers here that we're seeing, right? 8% experiencing sexual assault, about 16% with cyberbullying, 17% experiencing some sort of physical assault, and then lastly, 39% related to witnessing violence. And again, in their words, 20 to 25% of youth from low-income backgrounds experience 4 or more ACEs, which significantly increase the risk for health outcomes, such as adult diseases and what the research says is some kind of health risk behaviors as they get older. So we wanted to highlight that, but also share, the effects of ACEs and trauma in these major categories that I think most of us would probably have a lot of experience with, right? Seeing a lot of these impacts in learning, in the work that we do with young people. Seeing some of these behavioral indicators and cues, such as, right, having difficulty with paying attention and following classroom tasks and instruction might be something that you have witnessed or observed. And then lastly, relationships, right? Thinking about the impact of ACEs on relationships, maybe having difficulty feeling safe, difficulty trusting others, interfering with building secure relationships with adults and classmates at school, maybe having kind of that guard up, and kind of goes back to that earlier Stephen Porges quote, right? Are we noticing patterns of connection, or are we noticing patterns of protection? And so that's kind of alluding to this point here in terms of the secure relationships, and maybe struggling a little bit with that. And then lastly here is kind of creating challenges with initiating and cultivating, again, healthy relationships. Just kind of a few reminders for us here as we move forward into our next slide. And what we saw in kind of the early research around the ACEs, that there were some gaps in kind of there was the original kind of buckets of adverse experiences. So I love this infographic from 2017, and we have what I think is just more inclusive, right? And kind of getting back to our earlier word of holistic. We're thinking about what has impacted on young people individually or within the family, in the above kind of tree with the branches and the leaves. But what's so profound for me is the adverse community environments, or more of the systemic realities that are the roots, right? What's underneath that tree. We're seeing here things such as poverty, discrimination, right? Community disruption, lack of opportunity, be it economic or maybe social capital, poor quality of housing and affordability, and then violence. So what we're thinking about, again, going back to inclusivity, seeing the entire child, is really the need to see all of the systems and structures that are also impacting on the lives of the young people that we work with. And what's really important, again, in this conversation is that we're not just, again, overgeneralizing or alluding to anything or stereotyping when it comes to ACEs, but we are thinking about that if someone has experienced them, it doesn't necessarily mean that they're going to have a trauma response, or that they'll experience poor life outcomes. But there is research that does kind of illustrate that correlation. What's really important on this slide is the second point that kind of goes back to our earlier video around positive childhood experiences, that all of us on this call, all of the staff that we work with, have the ability to really impact the trajectory of someone's healing through the relationships that we can cultivate with them. So the research is really showing us that if young people have 2 relationships with non-family members, be it at school, be it in after school, that those relationships can be like these amazing positive buffers. So if you're able to kind of Google PCE, positive childhood experiences, there's a lot of great data and research that really illustrates that point that we wanted to just really center this morning with all of you. I think that gives me a lot of hope in the work, as well as when I'm supervising social work interns and staff members. We have a quote here that comes from actually a positive childhood experiences researcher, to kind of really bring this point home this morning, which is that every moment matters. Every interaction with a child has a reaction in that child. So even as we keep working to address the many social and cultural factors we need to address to prevent negative experiences, we should be focused on proactive promotion of the positive. In particular, there's a need to promote that through any door kind of way of being, so that wherever a child goes, to school, they're met with warm adults who purposely try to see and respond to them and meet their needs for care and guidance. So we hope that that can be uplifting to all of you. And we also wanted to share from the CDC, which I think is just really awesome and so comprehensive, their guide to trauma-informed approaches. So what they talk about is that this approach is not accomplished through like any singular technique or checklist. It requires constant attention, caring awareness, sensitivity, and possibly a cultural change at an organizational level, with certainly ongoing like assessment and improvements. And it really requires all stakeholders to be involved. So what they're naming for us are these 6 tenets of what they think are trauma-informed approaches. And these things consist of safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, such as voice and choice, and then lastly, cultural, historical, and gender issues. So I have a few slides next that I'm not going to have probably the time today to kind of go through all of the 6, but this will be sent out to all of you and you can have some reference around these kind of 6 examples of how you can bring this into the work that you're doing. So you'll see here a few examples on the first 3. And then just for time, we'll move forward. The next slide has the last 3 and some kind of really great examples of how you can kind of actualize this concept and like bring it into your everyday work with young people. I really wanted to highlight these last 3 in particular as so crucial to the work that I've been doing at the leadership program in schools across New York City, thinking about anti-oppressive work, anti-racist work, right in this time that we're living through with COVID-19, all of the social unrest the past 9 months. These factors in particular are crucial. So just really wanted to highlight in particular, thinking through maybe how to bring these into the work that you do moving forward with your staff members. And so Jorge and I were kind of playing around with, hey, if we got a couple extra minutes, we'll do some breakouts. I'm looking at the clock, so probably we won't have time for breakouts, but we do want to invite for that maybe just in the chat box for a few moments here. If there might be like any of these 6 principles that are kind of standing out to you or resonating this morning on what you'd like to be more intentional about, possibly in the work moving forward after today's session. So again, it's just an invitation, no pressure, but I'll kind of pause myself maybe for a minute or 2 and let folks kind of think through that a little bit more deeply.
You know, one of the best things about this job is that I get to be part of all these trainings. So I get to have these refresher courses and all of this. And I was thinking, just reflecting on so far what you've gone over, is just, you know, the idea of trauma happening before you can speak, and just kind of creating spaces that are safe when you are dealing with young people, that, and even staff that support, making them aware of that it might not necessarily be something that they did or that the child can even recognize that was a traumatic thing for them. It's just, they don't even know. It's something they have not recognized yet. And it's really critical for youth development workers at all levels to kind of be aware of that and, you know, have a better understanding that sometimes it's not about them. It could have been something that they did, but it can be very difficult to identify. So just kind of having that open mind and really kind of understanding that idea.
Hey, I'm sorry to interrupt. Stephanie, I just couldn't resist the opportunity to ask you this question. What do you do when you have children who have all type of adversities and all this negative stuff in their communities, and to them it's normality? What do you say to them to get them to understand that this is not cool?
That's such a great question. It's one that I continue to kind of ponder and grapple with myself. I think The framework that we're going to move into can support with your question, actually, when we're thinking about young people kind of furthering their own healing collectively. And so that's something where I have found kind of the power of young people talking to other young people about their community, about their experience, about parts of their identities where maybe they feel oppressed, where it's not coming from me so much, it's coming from the group. And so I have found sometimes just the peer-to-peer validation or mutual aid, kind of that flow back and forth, has been one way where youth have maybe seen things a little bit differently or through a little bit of a different lens or perspective. But I'm with you. That's a reality that we definitely come up against, is what has been normalized, where has there been just kind of that repeated prolonged exposure to certain factors, and how that can lend itself to just kind of feeling a little bit desensitized to those realities. So I have found kind of, okay, Steph, it can't really come from you. It's not going to really land as much, but how can the youth support each other in talking through their collective experience? So I don't know if that's completely answering your question, because I haven't found that answer, but it's something where I have found, okay, like we got some momentum. You know, we have other young people talking to other young people, and then sometimes it clicks a little bit more.
Thank you so much.
Of course, my pleasure. And I just want to, just for time, we're going to kind of just roll through a few slides here to kind of wrap up our time together. I wanted again to kind of center this amazing book, Hope and Healing in Urban Education, which has been really transformational in the work that we're doing at the leadership program when we're thinking about trauma. So really shifting from oftentimes how we've been socialized to think about like what happened to you, to this more strengths-based approach to like what's right with you, you know, and a real focus on those who've been exposed to trauma as kind of agents in their own well-being versus kind of victims of their situation and their kind of experiences. So this is also just a really asset-driven approach, and there's 4 elements of Dr. Sean Ginwright's approach. So I just, again, want to center his work. He's an activist and educator, also really doing great work on the West Coast in restorative justice, and promoting and facilitating healing circles for men who were justice involved, be it incarcerated, formerly arrested. So he comes to us with this approach, and I love it because while I am a social worker, this lens can be for any setting: education, hospital-based work, after-school settings, juvenile justice settings. So this healing-centered engagement philosophy is one that we can all kind of take with us and work to implement. The first tenet here is that healing-centered engagement is explicitly political rather than clinical. So again, as I was saying earlier, this approach is really allowing us to bring a social justice approach to trauma and healing and well-being. He's really asking us to consider how the awareness of young people around kind of the more structural realities of maybe their traumatic experience, having that awareness, so kind of tying the individual experience to greater systemic or institutional policies or procedures. That awareness combined with some social action that young person can take, things like protesting, community organizing in the school or the after school space, things like school walkouts, campaigns, things like that. That awareness plus the social action as a young person can really promote collective healing and well-being. So the healing is kind of moving out of the one-on-one space to more of a group collective healing. So I know that might be a little abstract still, but we're going to kind of move forward into the second element. So that was the first. And the next is thinking about HCE, is just for my abbreviation, that this is really culturally grounded, and it views healing as really the restoration of identity. And as we've been saying that, healing is really most powerful in a collective spirit. Sean Jenner is talking to us about healing experience as collectively is really one way to promote building a healthy identity, and even more importantly, a sense of belonging for that young person. So like, it's not just me trying to get to school every day. Like, I belong to this group of people. I have a purpose. Folks are looking for me. Folks miss me when I'm not here because I have an identity and a sense of belonging and community outside of just my own individual identity. And so he also shares a really important note here that for youth of color, that these forms of healing can be rooted in culture and really serve as an anchor to connect young people to a shared racial and ethnic identity that is really, again, historically grounded, and as he writes to us, contemporarily relevant. So that's just a really important point, I think, as we're talking about historical trauma and racial trauma. And then I have the last two elements here. On the left is that, again, this is a really asset-driven approach, focusing on well-being that we want, rather than like symptoms that we want to get rid of. So again, it's a kind of a more strengths-based lens, but really centering young people on what's right with you, look at all of your strengths, and how do we want to move forward together to support your growth. And then lastly, which I think is so important for all of us in the work that we do, is thinking about the well-being of the adults doing the work, be it program manager, social worker, educator, after-school trainer, that this approach has a real focus on restoring and sustaining the adults who are attempting to heal our youth. Right, so that's all of you. So it's a real focus on a healing the healers approach, and thinking about the self-care and the collective care of not just young people, but also the adults who are doing that frontline work. So I really love that he includes this as a part of the framework for his approach. And now we're just going to take a brief kind of content pause and ask folks to just maybe fill out the evaluation that's required of all of our workshops. If you would, just so kindly take a moment for that evaluation. And you see here on the slide, there's a Scan Me code or a website that you can access as well. And then after a few moments, we're going to come back for some next steps that we can all take in terms of kind of expanding our work to include the HCE approach. Jorge, did I miss anything?
No, you got it. I dropped the link into the chat, folks. So okay, you can just drop that. You click on that link if you don't have your phone handy. I'm gonna give you guys a couple of minutes to fill out that survey. It shouldn't take that long.
Great.
While folks are filling out the survey, I just want to, there's a lot of good work around healing and healing-centered practice. I have to look something up. There's actually a community school organization down south that is actually doing this in practice in their school. I'll try to get you that resource, Stephanie, so we can share it out with everybody else. But it was based on this work, and it's a completely different approach from how we've kind of handled it in the past. So I think there's a lot of promise there.
Thanks so much, Brian. I would love that resource. And yeah, I think there is a lot of promise there, and no time like the current, right? Just in terms of everything that is happening within our socio-political context, really kind of thinking about how we can bring, like in social work, we talk about a liberation health framework. So kind of moving beyond the one-on-one work to think about advocacy and change that's needed at the kind of the meso and the macro level. And this approach really reminds me of that too, for young people to kind of be an agent of change in their own healing through collective action, through talking to other youth, and really kind of telling the adults, like, this is what we need. And adults really kind of like promoting and supporting that work in their schools or their after school programming. So I'm with you. I think there's a lot of promise and a lot of hope moving forward. Oh, this is amazing in the chat that there's groups forming across New York State through the Office of Juvenile Justice to engage in this very framework. That is fantastic to hear. Thank you so much, Dr. Laura. Yeah, I think that's why it's such a great framework, because again, it can be really applied to any setting, right? Any environment of which youth are engaging in, which is pretty much all of our systems and structures, right?
For
So they're
sure.
kind of have these different points of different touchstones, right? I guess in their lives.
That's right. All right. I hope everybody had a chance to fill out that survey. Please do. It's critically for us to kind of get this information. And we have another community schools TARC out of SUNY Binghamton will also be engaging in this framework. Dr. Laura, I would love to hear more about this, and definitely send me over any links so I can share with folks who registered and are on the call and with everybody else. On that note, I am going to go to the next slide, and it's all yours, Stephanie.
Great. Thanks, Jorge. Thanks, everyone. We're kind of getting to our last final slides here. So for some next steps regarding this lens, there's kind of 3 next steps that we can ponder together. The first being continuing to just kind of build empathy with young people who've experienced trauma. Dr. Ginwright talks about an empathy exchange. So it's sometimes kind of bringing our use of self right into the work with young people, creates more safety to discuss complex feelings and experiences. He also encourages us to think about, as we all do, I'm sure of this, encouraging our young people to dream and imagine, and just realizing that that ongoing crisis management can really impact young people's ability to kind of see beyond the present and think about the future. So kind of an important reminder for all of us. Creating spaces for young people to kind of play, reimagine, design, and envision their lives beyond the present moment. And then lastly is building critical reflection and taking what he calls loving action, that we're really thinking about, again, healing and well-being as being fundamentally political and not just clinical. So that's been a big shift in kind of the way that we've been thinking about in our own organization, supporting young people and thinking about different advocacy and next steps that we can support them and really empower them to take in their own lives. And then lastly, just a couple like maybe potential commitments that we can think through in this framework, or things like, training all staff on principles of anti-oppressive practice, on liberation education, liberation social work, for example. Thinking about providing culturally relevant interventions in our schools. A lot of us are really familiar with culturally responsive pedagogy, and how are we really kind of taking next steps in that bucket of need. Continue to train our staff on self-care, self-preservation, and collective care, right? Leaning into clinical and school-wide context and systemic issues that are impacting young people's lives. And then lastly, promoting self-advocacy and collective loving action. I wanted to share, these are 3 bullet points from my own work the past about year or so with my staff. We've been supporting with like mental health campaigns. We had about a year ago now, year and a half ago, forgive me, during Mental Health Month, which is usually in May, we had an all person of color panel of experts from the community in Brooklyn talking about mental health and kind of bringing in the experiences and realities of things that we talked about today regarding historical trauma. And that was a really powerful student-led request and demand that they work to meet. And that was a part of their own healing, is to kind of reduce stigma, demystify mental health for Black and Brown individuals. So they were really strongly committed to that panel, and it was a really huge success. Thinking also again about restorative practices as a part of this framework. I know that's a big thing here in New York City. In particular is RJ and how we're kind of infusing that into school-based work, especially following, tragic events in our communities. And again, a way to bring in that collective healing, moving beyond the one-on-one supports to more group and collective supports. And then lastly, thinking about, we created one of our Bronx schools about 2 years ago, actually, a reflection room following a very tragic loss of a student, very abrupt and sudden. And so that was a really cool space for young people and a very calming space. I say cool because it was really full of beautiful activities to engage in, a big kind of open newsprint, almost kind of like a graffiti wall, we called it, where folks could like tag up the wall, share quotes, thoughts, and stories of that young person. We had music playing. We had a lot of like tactile sensory tables set up, places for folks to draw, write, and also we had some social workers and teachers in the space just for some face-to-face chatting and talking. So a few ideas I hope that maybe could be useful, or maybe you've been already doing some of these things in your work now. So I just wanted to, in our last few minutes, say thank you for your time. And to thank again Jorge for just being such an awesome sidekick. And I wish you all a great rest of your week. I know everyone's so busy, so it means a lot to have part of your morning spent here with us today.
All right, folks, for those that did not get a chance to do that eval, please jump into the chat and click on that. We want to thank Stephanie. We want to thank Felicia, Lori, Alita, and all the folks at the Resource Center for all of their great support and just a wonderful all around. All of the sessions have just been fantastic. I've learned so much. I hope you all have too. I think we see a lot of stuff coming into the chat. I can't find my chat box right now, and I'm not going to scramble around looking for it because, in the madness of these computers nowadays, but I'm glad someone found that joke funny. And I'm going to play a little Jackie Wilson as we leave because, you know what? We all need a little bit of love, and you guys are giving it to all of these young people and making them feel better and better every day. Thank you so much for your time. I'm going to put up some additional resources. Don't take a picture of it. We'll send this out today. You are going to get the slide deck today. As usual, adios, folks. You don't have to go home. You might actually still be home, but you do have to leave this virtual space. So, thanks for joining us. Bye, everybody. Thank you for those who showed their face. It's always good to see faces. For those that I don't, I can't wait to meet you in person. And looking forward to the next time. That's right, Stephanie. I love it. I love it. Can't help it. It's just such a great song. All right. Those that were inquiring about certificates, we're going to get working on that right after this poll. And we're going to try to organize all that and get it back to you as soon as possible. We're aiming to do it before the end of the week, but you might see it in the new year. But you'll definitely get them with all of your requirements. We'll actually be meeting on that a little bit more. So be patient. You'll have the material a little bit later today, folks. And thank you for joining us. I'm going to close that room real soon. I hate kicking people out of my virtual room. So if you're there, it's time to hop off. Thank you so much for joining. Music's coming to an end. Stephanie, I want to say thank you so much just for great training. A lot of people got a lot out of it. I know I did. It's actually a pleasure working with you.
So nice working with you too. I hope you again in this work will be awesome.
Great. Broke up a little bit, but I'm going to say that you said nice things about me because that's what I want to say and that's what I want to believe. So, all right, let's see. Almost there.